Good morning, everybody. Yeah, thank you for coming. I would say, I will always post the lectures on Canvas, and you can get access to it. But try to come to the lectures so that you got time to listen, so that you don't really have to go through by yourself again. Like give yourself about 2 hours, 3 hours a day, like 3 times a week. And as I say, anatomy is 5 credits, and it is nearly double comparing to the 3 credit classes, which means your input need to be double. Yeah, so if you are doing 3 credit class, and if you give like about 4 or 5 hours a week, you have to give like about 10 hours a week for anatomy, because the credit you're going to get is going to be double. And I don't want you to like get lost, like gradually following, and then you lost interest because you cannot make it. You try to listen and then you don't understand, and I don't want you to get into that cycle. So please do come as much as you can. And we're going to talk about bone and skeletal tissue. So this is the second week of our class. So first week, what did we study? We studied about introduction to anatomy, like anterior, posterior, proximal, distal, coronal section, sagittal section, that sort of stuff. And second day of lecture was the tissue, like a human being. Basic structure of human being is a cell. Combining all the same cells together, we have a tissue. Tissue is a combination of cells. And in human beings, we only have four different types of tissue, basically, like epithelial tissue, connective tissue, muscle tissue, and nervous tissue. A human being is nothing more than that, not bigger than that. But of course, each and every tissue has been twisted a little bit to get the function we want and we need for ourselves. And then on Friday last week, we talked about skin. Skin became a organ because skin is a mixture of different types of tissue. So skin became a composite tissue, like epithelial tissue, connective tissue, and many other cells combined together. And the skin with the nail and many different appendages from the skin, it became an integumentary system, like our skin and hair and nails and everything else. So that gradually became coming from the cellular level to tissue level, from tissue level to organ, and then system. So now we are going to talk about bone and skeletal tissue today. So the bone itself is an organ because it is a combination of connective tissues, different types of connective tissue together. But if we assemble bones together, we get the skeletal system. So the whole body, like the skull, the spine, our arms and limbs, all together combination became skeletal system. So I know, it is quite a lot to push this amount of information to you, like within 1 week. But I was saying to one of the students here, so if we push hard quickly, and I think on Friday and on Wednesday, we will talk about joints. So on Friday, we will not take in any more new information. So we just sit back, try to relax on Friday, and we talk like revision of the previous lectures. And then I will open the exam on Friday, so that you can do that on Friday or weekend. I'll open the exam for like about 4 or 5 days, so that whenever you have a chance, you do it. It's not going to be difficult. It's not going to take a long time. I think, after 5 lectures, big lectures, and a lot of basic anatomy, we have to refresh our memory so that we won't forget. And the exams is good because it just like, make you read a little bit, make you polish yourself a little bit. and you get two chances to do the exam. So which will be good. And yes, so like it's hard because you must be taking another class. You must have your family, social, relative, everything around you. And on top of that, I'm pushing all these information in your body. But just push yourself. Is it a nature or is it a nurture? Doesn't really matter. I think it's a combination of both. Yeah, these are the special foods. If you imagine what they can do, it is extraordinary, isn't it? How do they get it? Yeah, it's their natural talent as well as the nurture, like the training they get, push or squeeze them out. And this is a webpage from South Africa Diamonds. Like if you want to make a diamond cutter, how far do you want to practice again and again, again and again, again and again? So yes, this anatomy class is at the very basic of your human science, because you are going to take this information for your many other classes like doctor or nurses or physician assistant or whatever you choose, or technician, medical technician, whatever you choose. So these anatomy knowledge is the basic, because if you do not have an sound understanding of human body, I don't think you can go that far. You will just struggle again. So as we say, tissue, cell, human being is a multicellular organism. Cell is the structural unit of livings. And if we combine all the cells with the same fashion, we get tissue. There are 4 types of tissue in our body: epithelial, connective, muscle, and nervous tissue. So now we are going to talk about connective tissue. So connective tissue, there are 4 different types of connective tissue. They are connective tissue proper, which include fat, fibrous tissue, and skeleton and cartilage. That is what we are going to talk about today. And blood. We just, at the moment, we are not going to talk about blood. So blood is a form of connective tissue. So we are going to talk about 2 subtypes of connective tissue, which are skeletal tissue and cartilage tissue. So look at this diagram, just a reminder. This is all these, if you look into the microscope and if you start seeing all these, I want you to remember connective tissue. Why? It is not epithelial tissue. Because if it is an epithelial tissue under the microscope, the most striking feature is cellularity. You see loads and loads and loads of cells. You can't even count. It just blind your vision. It's so dense, pink, purple. And on top of that, polarity. Polarity means they will be sitting on another type of tissue, and their opposite side is open into the empty canal, which is the external environment. Like for example, skin is exposed to the external environment, or your alimentary tract, like gastrointestinal tract, which is exposed to the external environment. It is exposed to the food you eat in. So we do not have these features, and therefore it cannot be epithelial tissue. And what about nervous tissue? Nervous tissue, you have to see the jellyfish, big starry fish, like neuron. It's not there. And muscle tissues are so different, isn't it? You remember these muscle fibers are going parallel or just layer by layers: cardiac muscle, skeletal muscle, and smooth muscle. So this must be connective tissue. So connective tissue, there are 4 different types of connective tissue. 1, 2, 3, 4. The blood, you will see like that, like little blood cell, like white blood cell, red blood cells will be floating around in the sea. And the loose areolar connective tissue or connective tissue proper, or any connective tissue, as we say, connective tissue is made of cell and matrix. Cells are not as many as the epithelial tissue, and they are floating in the sea or in the desert of matrix desert, and there are a few little cells here and there. So if you look at these pictures, connective tissue slides, so there there is a large matrix, and you can see the cell spots here and there, which something you can call. Again, here, like there is a matrix and the cells here and there, here and there, here and there. And the same thing, like, like this matrix, cartilaginous, the matrix here, the cells are here, spots and there. This elastic cartilage is slightly different, a little bit more like a big cells, and a little bit more cellular. But hyaline cartilage, elastic cartilage, and fibrous cartilage, they have like a similar pattern, or even the bone. This is the histology slide of bone. Like if you look at the bone under the microscope, this is what you are going to see. And you can see the matrix and the cells are floating here and there. What is the big difference with this and this? Of course, arrangement is different, but in general, it is not different at all. It is a sea of matrix, and the cells here and there are floating around. So the same thing, like this is the connective tissue proper slide, which is this connective tissue proper, loose areolar connective tissue is a supporting tissue for the epithelial cell. This is the bone connective tissue. This is the cartilage, 3 different types of cartilage connective tissue. And this is the blood. What is the difference? Not much difference at all. There is a matrix, and on top of matrix, the cells are floating around. So this is what we are going to talk about today. We are not going to talk about this connective tissue proper. We are going to talk about bone and the cartilage today. So this is a picture I got from OrthoBullets. So OrthoBullets is a good website, if you want to go and check like some information about orthopedic stuff, a fracture or giant bone and joint problem. It is a free website which is open to everyone, and it is very good, very well written. This patient, like let's say 25-year-old guy, motorcyclist, high speed, came off from a bike, and then bang, his leg, and this is the right tibia. So right leg, this is the foot, this is the ankle, this is the leg, which is the big bone in the leg. It's called tibia. And this is the knee joint, and then going to the feet and thigh. So these injuries are pretty common. Once you start working in a trauma center, emergency department, emergency room, you are going to see this sort of scenarios. Look at that, the bone has been smashed and the skin, lost the skin already, where you must have lost some muscles around the here as well. That is pretty common. So how do we deal with this injury? So yeah, it's quite difficult, but the first thing is make sure the patient is alive, so revive the patient, make sure the injury is protected, and then take the patient to operating theater and then start doing the wound debridement. So this is a picture from the operating theater where we did. So the wound has been debrided. So all the necrotic tissue, all the dead tissue, all the debris, all the darts being taken away. The wound has been washed. The bone has been reopposed to the best possible position, and then temporarily it is fixed with which is what we call external fixator, because we cannot close the wound because the skin around your leg is pretty tight. You cannot stitch from this side to this side. You cannot close it. If you close it, it will just pull apart. On top of that, there must be infection because this wound has been that open with the dart or the exposed to the external environment. So we cannot close this wound. We just leave it open. And what we are seeing is a broken bone with the lost soft tissue, which include muscles, fat, and skin. We lost it already. But at least now we have cleaned the wound to the best we can, and the broken bone has been stabilized. And we are not putting any like a foreign material in the fracture site, and we are as little as minimum as possible, because these foreign body, once the infection get on the foreign body, then that is another disaster. So we just, hey, I give you some support, you just take it easy, you just rest, we give you antibiotics, and we treat the infection. So what what is a bone? So we talk about a fracture. Fracture is the break in bone cortex. So what is a bone? So we need to know what we are talking about. So definitions are important because that is the only way we can check whether we know what we are talking about. So what is a bone? A bone is a specialized connective tissue. Yeah, connective tissue. It is a connective tissue. Because connective tissue means it is made of cell and matrix. So bone is a specialized connective tissue which is made of cell and matrix. Full stop. So whoever asks you, your tutor or your attending physician, doesn't matter. The answer for what is a bone? The bone is a specialized connective tissue which is made of cell and matrix. So what is the cartilage? Again, cartilage is the specialized connective tissue. Yeah, it is not just basic connective tissue. It is specialized. You have to twist it to get a bone. You have to twist and manipulate the process to make a cartilage. So a bone or a cartilage is a specialized connective tissue. Being a connective tissue, it is made of cell and matrix. Of course, you know that the matrix are made with the collagen or elastin or reticular fibers. Depending on the structure, they will put different ratio of collagen or elastin or reticular fibers. And on top of that, they will put different cells like bone. If you want a bone, you will put bone forming cell, osteoblast. If you want cartilage, you will put cartilage forming cells, which is chondroblast. Whatever it is, they came from the same origin, which is connective tissue. So if we connect two bones together, that is what we got a joint. A joint is the junction between the two bone surface. So now, because bone is an organ, another bone is an organ, joined together, we are joining two organs together. Now it's become a structure, and it is going to be part of a system. So now I believe you got the information, what is a bone and what is a cartilage. This is a reminder from our previous lectures. This is the areolar connective tissue. How do we know that it is a connective tissue? Because it is not epithelial tissue, it is not muscle tissue, and it is not nervous tissue. And it is a connective tissue because we know that from basic instincts, our mind knows that because there are seal of matrix and the cells are sparse here and there, here and there. If you give yourself about 10 minutes, you will be able to count how many cells we have in this slide, this microscopic slide. And this is a arrangement of the typical areolar connective tissue, which is used for the support for the epithelium. Yeah, so epithelium polarity, it is sit on one tissue and it is exposed to the other tissue. So this epithelium is sitting on the areolar connective tissue. Right. So what about cartilage? Cartilage is a connective tissue, and there are three types of cartilages: hyaline cartilage, elastic cartilage, and fibrocartilages. And again, the same, is it a big difference? Like, yes, it looks different, but underlying difference is not much. Yeah, so there are seal of matrix here and there, and you can see the cells here, one cell, one cell, one cell, one cell cells. Cells are sitting or floating in the sea of matrix. So elastic cartilage looks a little bit misleading when you look at the microscope, because you might say, oh, hey, too many cells, very much stacked together. So that's just a little bit careful about elastic cartilage. But when you come to the fibrocartilage again, it is pretty similar. Fibrocartilage and hyaline cartilage are pretty similar. You can see the seal of matrix, and you can see the cells floating here and there. So how can you differentiate between fibrocartilage and hyaline cartilage? Just wonder, if someone can say what is the difference between this slide and this slide. So if you're looking under the microscope and you see this, if you're looking under the microscope, you see this. So what is the difference? Just say something.
It looks like the hyaline cartilage, the matrix is more white.
Yeah,
and on
true.
the fiber cartilage, it's more pink and swirly.
Yeah, that's true. It is a little bit lighter, isn't it? It's a little bit pinky and lucent color. Here, you can see the collagen fibers are running here. You can see the collagen fibers here. So you cannot see that because these collagen fibers are a little bit rough collagen fibers, and these collagen fibers are a little bit fine. So that's why it is a little bit more transparent. This looks a little bit rough, like a tornado or just storm coming into the Florida, New Orleans, or this like a satellite. The storm is coming into from the sea into the land, like these fibers. And these fibers, as you say, it's because the fibers itself are very thin collagen fiber. That's why they are a little bit more transparent and it's a little bit pale pink, rather than something rough like a big, large collagen fibers invading into the land. Of course, elastic cartilage is slightly different, isn't it? It is. I can't even. It's just like you have to remember like a microscope for microbiology. You are seeing the bacteria. So whatever it is, now you can see the difference between hyaline cartilage and fibrocartilage and elastic cartilage. So if you look a little bit more detail, as we say, the basic structure is the same. So in the sea of matrix here, there will be matrix here, there will be matrix here, and there will be cells. The cells are here, here, and here. The cells for the cells for the hyaline cartilage, chondrocyte cartilage forming, cartilage site cell, cartilage forming cells are here. The cell fibrous cartilage, chondrocytes, the cells are here, and the elastic cartilage, the cells are here. So what is the difference between these three cartilage and these three cartilage, which are connective tissue, and the very first cartilage, connective tissue proper? The difference is the cells for this hyaline cartilage tissue, they are sitting in the little pockets, which is called lacuna. So lacunas are little pockets in which the chondrocytes live in. So chondrocyte staying in the lacuna and chondrocyte floating in the sea of cartilage matrix. So that is what we have to pick up from this one. So now the cell and matrix, in the matrix, the cells, chondrocytes, they are not just floating in the matrix itself, they stay in the lacuna, which is like a little pocket or little lake, lacuna lake, and that little pocket that the chondrocyte sits, and that combination will float in the matrix of the cartilage matrix. Hey, so what is this slide? So I give you a slide and you look at the microscope, you look under the microscope and you see this. What are you seeing then? What sort of tissue is it?
Epithelial tissue.
Brilliant. Yeah, that's epithelial tissue. Yeah, that's the difference between epithelial tissue and connective tissue. Because look at that. You cannot count these nuclei. So one nuclei, one cell, multiple nuclei. It's not going to finish counting all these cells. And they are sitting on the another type of tissue, and their opposite side is open to the external environment. This is the connective epithelial tissue. So that's the difference, connective tissue and epithelial tissue. Now gradually getting out of this bowl. So connective tissue is made of matrix and cell. So what is the matrix made of? Of course, matrix is made of fibers and ground fibers and ground substances. Fibers are collagen fiber, elastin fiber, reticular fiber. This information is not new for you. Yeah, so collagen fiber, if you want to make connective tissue matrix, you get some of collagen fiber, some of elastin fiber, or some reticular fibers. Or you might want only one or two, or you might want only one, depending on what sort of connective tissue. Is it a bone or cartilage you want to make? You might put only one fiber, or you might put all the fibers together. But you have to take one of the fibers from this. And there is always ground substance you combine with. So ground substance and the fiber you mix together. Now you got a sheet of dough like a pizza. It's not finished yet. You put something on top. Like you have to put cells like fat cell, white blood cell, macrophages, and mast cell, plus if you want fibrous cartilage, you put fibroblast. Fibro means fibrous tissue, blast means forming cells. Chondroblast, chondro means cartilage, blast means chondroblast means cartilage forming cells. Or you put osteoblast, osteo means bone, blast means cell, osteoblast. So with this matrix, like a dough of pizza, and you put whatever you like toppings, then you will get the cartilage you want. So cartilage is a specialized connective tissue which is made of cell and matrix. A cell will be chondrocyte. Chondrocyte is sitting in the lacuna in the matrix. And matrix is made of elastic fibers, collagen fibers, and ground substance, as we talk about, like proteoglycan, glycoside, aminoglycan. These are little like jelly-like structure, which is just like because the fibers are running like that, meshing each other. So there will be holes in between the fibers. So these holes need to be filled with like a glue, like a jelly substance. So we use the ground substance because ground substance, these attracts water. That's why the cartilage are so filled with water. That's why cartilage is a little bit bendy and soft and flexible. And yes, now you got your cartilage, you protect your cartilage with another layer of connective tissue, which is called perichondrium. Perichondrium means peri, around, chondrium, cartilage. Around the cartilage, you put a blanket around, which is the dense irregular connective tissue. So that is cartilage in our body. So where are the cartilages exist in our body? Yeah, so it is our ear. If we hold our ear, that's the cartilage. But it is so bendy. You can twist your ear, leave it will go back to its position. So why is that? Because it has elasticity. Elasticity means like it will deform. If you leave it, it will go back to its original shape. That is what we call elasticity. It is different from plasticity. Plasticity means it is plastic, means it will deform. And when let's say if you bend this iPhone, it will get bent. If you release it, it might not go back to its original position. If they do not go back to original position, it is what we call plastic. They will follow your shape, but when you release your force, it will not go back to its own original shape. It might go back somewhere near the original shape, but it will not go back properly to its original shape. So that is plasticity. Now, with the ear, we are talking about elasticity. So you can twist as much as you like. You can twist as many times as you like your ear, but when you let it go, it will go back to its original shape. That is the property of elastic tissue. So our ear is cartilage, which is the elastic cartilage. So there are many other cartilages in our body. If we look at that, if in our chest bone, so between two breasts, in the center, we have breastbone. And so the ribs will come and connect. The ribs will start from the back of the spines and then come in as a bone. And before they come and connect the breastbone, they become cartilage. So the ribs connect to the breastbone as a cartilage, especially when we are young. But of course, once we get really, really old, then these cartilage can get calcified and then become bony structure. But generally, for you and me, the ribs are attached to the center breastbone by the cartilage, and that is also a cartilage. So the joint here, the end of the long bone, humerus, radius and ulna, the joints surfaces are covered with the cartilage as well. So there are many cartilages in our body, many different types. We use different types of cartilage depending on what function we want and depending on where they are. So that is our job to use it. So that is, as we say, our ribs coming from the spine become bone, and then before they attach, they become cartilage. So that is what we call chondral cartilage. So let's say if somebody died, this is the most of the skeleton, isn't it? The ribs coming out from the spine as a ribs, and then before they come and attach to the breastbone in the center, they become cartilage. So when we die, the cartilage will melt away, the bone will not. So that's why we will have this open space in between the rib and the center bone. And again, this is the ultrasound scan of a pregnant lady. And here, this is the fetus. We can see the head, the face is here, the body is here, and the limbs are here. It's just like a fetal position. So these little fetus, before they are born, they are mainly made of cartilage. So their bony components are so small, they are little, very, very much like a cartilage, on top of it. Of course, during the development of the fetus, some of the cartilage become bone, some of the cartilage become bone. But so in fetus, they are cartilage, most of their body is cartilage. So now elastic cartilage, we talk about our ear is elastic cartilage. That is a very good example. Tip of our nose. You can twist your nose as much as you like, but if you let it go, it will go back to original shape. That is the property of elasticity and ear. That's a very good example. So elastic cartilage, as I say, the histology appearance of the elastic cartilage is a little bit daunting. And the cells are pretty big and really forward, like an owl's eye. But what is the big deal? You can see the matrix here, elastic fibers here, matrix, and you can see the lacuna here. And chondrocyte, because it is cartilage, so you want chondrocyte is sitting in the lacuna. So it's simple. And of course, inside the elastic fibers, we need to put some jelly-like so that we can make a sheet. There will be no more holes. These gelatinous structures are ground substances, which are proteoglycan, glycosaminoglycan, and water. So that is elastic cartilage. So elastic cartilage, we will use chondrocyte because cartilage, and we will use delicate collagen fibrase and the mainly elastic fibers matrix. Elastic fiber matrix. The collagen we are going to use is very delicate. That's why it can twist and bend and go back. It is mainly for the flexibility and elasticity. Where are we going to use? Ear, nose, tip of the nose, and epiglottis. Epiglottis is a structure like in our respiratory tract, which close and open the respiratory tract during swallowing. So do not worry about that epiglottis, but our external ear is elastic cartilage. So that is pretty simple. That is all about elastic cartilage we need to know. So the next cartilage is hyaline cartilage. So there are lots of hyaline cartilage in our body. So the cartilage which covers the bone at the junction as a joint is a hyaline cartilage. Our respiratory tract, our trachea, which divides into bronchi, right bronchi and left bronchi. So these trachea, bronchi, these are also hyaline cartilage. Hyaline is clear, like you said, this color is pale and pink and clear and nothing to do like a fibrous cartilage matrix. That's the same, isn't it? The matrix, inside the matrix, the cells are floating in the lacuna. So this is the hyaline cartilage. So hyaline cartilage is the most abundant cartilage in our body. They have a round chondrocytes here. Their matrix is collagen, only collagen. So that is again like that might be contributing to this particular feature of matrix. Nice, clear, smooth, pale, and soft. Only collagen. There is no elastin, there is no reticular fiber, only elastin. The matrix is made of, and they have lots and lots of water. They are both combination for some sort of flexibility, not a lot, not like ear, like elastic cartilage. Ear, I mean, you can twist your ear like 2, 3, 4 times. You can twist your ears, but you cannot twist your hyaline, the structure hyaline cartilage. You cannot twist the trachea, the windpipe. You cannot twist that much. It will not withstand that flexibility. So some sort of flexibility and some sort of resistance or resilience. I mean, like you can keep banging on it, resilience. So that's why we put this type of cartilage on the articular surface, joint surface, because whenever we walk, we run, the two bones are banging on each other, bang, bang. So this pressure need to be covered by the hyaline cartilage, because hyaline cartilage is for resistance and resilience and flexibility. So it's just absorb the energy of impact. So we will use this hyaline cartilage for the joint surface and respiratory tract and chondral cartilage, costal cartilage, the rib bone to come attached to the breastbone. We will use the hyaline cartilage. So what about fibrous cartilage? If you see, the fibers are rough, it's just like a storm coming into the land, because they are rough fibers. So they are pretty strong. Their job is not delicate. Their job is for strength, like holding two bones together rigidly. So the fibrocartilage, of course, cartilage, so we have to use chondrocyte. We cannot use osteocyte. And the collagens are thick fibers, thick collagen fibers. Yeah, we have to use thick collagen fibers for the matrix. Like for the hyaline cartilage, we are using only collagen fibers. And for the elastic cartilage, we are using delicate collagen fiber. So that is the difference. We are using different in a different way, different cells, and that is what we get, the result. So chondrocytes, collagen, thick collagen, that's why you can even see the bundles of collagen there. It is mainly for strength, durability, so you resistance. So that is what we are going to use this cartilage for. Yeah, so especially like intervertebral disc, articular disc, so the disc in between the vertebra, we have to use because it is pretty harsh and it needs a lot of strength. So let's look at this diagram. This is a knee joint. This is a knee joint. This is the lower end of the femur. This is the your patella. So, and this is the upper end of the tibia. And this is the fibula. This is the right knee, right lower end of the femur, patella, right tibia, and fibula. Tibia is on the medial side and fibula is on the lateral side. I believe you remember all these bones: femur, tibia, fibula, patella. So this is the drawing. This is my drawing, which is not very good. So tibia, fibula, femur, Well, but what I want to show you is in between the two bones, we have a crescent-shaped structures, one on the lateral side and one on the medial side, sitting on the upper surface of the tibia. That is what we call meniscus. So I believe, some of you guys who have been active, like contact sports or skiing or jumping, might have had damage, or the persons like especially those in the military, like they are jumping and doing exercise, a lot of things. So you might have heard of the meniscus injury. So these are the meniscus, which is sitting in between two bones, sitting on the upper surface of the tibia. And they are crescent shaped, one on the lateral side and one on the medial side. So let's say if we do a keyhole surgery means arthroscopy. Arthro means joint, scopy means looking, arthroscopy means looking into the joint. So endoscopy means endo means inside, scopy means viewing. So endoscopy means looking inside. Laparoscopy, Laparoscopy, laparoscopy means lepro means abdomen, putting the scope into the abdomen, looking inside the abdomen. So this is the arthroscopy, which is keyhole surgery for the knee, showing cartilage. Hey, this is the meniscus I was talking about. So this is made of fibrous cartilage. Yeah, so this is the joint surface, which is the upper surface of the tibia, which is covered with the hyaline cartilage. And this is the lower joint surface of the femur. So this surface, the white here, the white gray here, that is the joint surface, lower end of the femur on the joint, covered with this surface. This is the articular surface, which is made of hyaline cartilage. So now you can see the hyaline cartilage from lower end of the femur. You can see the hyaline cartilage, which covers the upper end of the tibia, and the fibrous cartilage, which is called meniscus, sitting in between these two cartilages, in between two bones. So the joint is trying to absorb a lot of energy you are going to use every day. The cartilage, articular cartilage, hyaline cartilage, will take some impact. The articular cartilage of the tibia will take some impact you create. On top of that, this meniscus, which is the fibrous cartilage, is going to absorb some energy you impact on your knee joint. And that is the way, our knee joints can last for a good long time. So let's say this articular surface, knee joint, meniscus, hyaline cartilage of the femur, hyaline cartilage of the tibia, they look pretty pristine. So I would say this cartilage might be for someone like in their early 20s, Of course, we keep banging the knee all the time, jump, run, do whatever I like. I believe, the same similar picture, similar photo, but this hyaline cartilage is not as pristine, not as smooth looking as this one. And this surface is also not as smooth looking as this one. You can see a little bit thin out already. And on top of that, this meniscus is starting to get ragged, like the carpet you have been using for like 10, 15, 20 years. So this knee arthroscope might be coming from a patient who is like 45, 50, 55, 60. And this picture might be taken from somebody who is like in their early 20s. So that is the difference. That is the way the cartilage change with age, because we are using it's gradually wean off. Yeah. So now you can see the cartilage, different cartilage in real life. This is the fibrous cartilage, and this is the hyaline cartilage. This is what we call meniscus. So let's look at another photo. Your heart sink. So you are doing a keyhole surgery, arthroscopy. You might be the assistant, you might be the surgeon who is, now the chondral surface, you can see the meniscus here. You can see the upper end of the tibia. This is the lower end of the femur, which is covered with the higher lying articular cartilage. You can see a big damage in this here. That is what we call ulcer in the cartilage. So the cartilage has been like broken apart. How can you do this to your knee? And this is the exposed bone. So usually the bone is too sensitive to take the weight. If the bone is taking the weight, it will be painful. It is arthritis. So now, and that's why the cartilage has to cover the bone, because the cartilage does not have enough supply. That's why, and the cartilage is very bouncy, very elastic. It can take the impact of the weight. Now, this patient is going to get knee pain. You can see a big exposed area of bone here. The cartilage, hyaline cartilage, which is covering the bone, is damaged away already. That is a disaster. On the tibia side, tibia articular surface looks good. The meniscus, with what we can see from this picture, it looks good as well. So he must have like a twisting injury, which chip off the cartilage from the femur. Hey, that is a big deal, you know, especially in 2030. But you know, once we became like on this right side, the femur, tibia, and fibula, this is a joint, knee joint. The patella is here. You can see the shadow of the patella. And there is a space in between two bones. This space is filled with these previous things here. This cartilage, hyaline cartilage, and meniscus. So this point, the space is good. This point, the space is narrow, which means the cartilage is gradually weaning off and the cartilage is gradually thin out. And if you look at here, the cartilage is gone. That's why the bone on bone joint, this is the arthritis. Yeah, so this is normal looking. This is a little bit narrow cartilage joint space. This is no more cartilage at all. We can look at the x-ray and then we can say, hey, the cartilage is gone. This is arthritis. So that is the way we try to interpret. And let's look at another hand. Oh, this is the femur of a baby, because it is not an adult mature skeleton. You can see the bones, there is a gap. So these gaps are filled with cartilage, and there is a fracture here. Fracture is the break in bone. Bone is the specialized connective tissue. So in this X-ray, we cannot see the head of the femur. There is, because the head of the femur is there in a cartilage stage. You might see a little bit shadow here, but not really. That is when we are young, little baby, most of our bones are still in a cartilage. Even when we come out, like in the childhood, you know, very early childhood, we are filled with loads of cartilage. So in this, you can start seeing the head of the femur. Oh, what's the difference? The head, then this is the cartilage portion. This part is again like gradually damaged for whatever reason. But what I want to show you is the different cartilage and the different way of seeing the cartilage. Whatever it is, you know, it is not this side of cartilage. This is connective tissue. This is connective tissue in the microscope. And you can see the sea of matrix. The cells are floating away. You can see the collagen fibers running. There is no polarity. And pretty similar, guys. You know, you can see the cells floating here. You can see the sea of matrix. But in this slide, you know, microscopic slide, the cells are arranged in a very particular fashion. It's just go cycle and cycle and cycle. It's just like concentric onion. Like there is a little central hole here, in the center. There is a little central hole in the center, and all these cells are going in a circular fashion surrounding the central canal surrounding, and it is not by accident you are seeing these little fibers like a sunshine radiating from the center outwards, and that is the edge of this sort of, that is the bone. This is the another connective tissue, but the bone is a specialized connective tissue, not just random connective tissue. It's arranged, it's fibers, it's structure in a very specialized way, and it is more than beyond our belief. You know, it is very so specialized, and that is what we need to study today as well. So this is the connective tissue. This is the microscopic slide of the loose areolar connective tissue. The fibers are going slightly random, the cells are floating. I mean, it is not like you might want to say, is it a hyaline tissue? Might be. Is it an elastic tissue? No, because it's very elastic tissue, like the cells are bang, 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 like banging our eyes. And is it a fibrous cartilage? No, it's not fibrous cartilage, because fibrous cartilage, the connective tissue fibers are thick, dense, and rough. So it is not fibrous tissue. It is not elastic tissue. Could it be a hyaline? Yeah, sort of, but you know, there's difference between the hyaline and the areola is this one. So now let's dig into the bone. So the bone, like if you look at the bone, you might think, oh, the bone is really solid structure, really solid structure. But if you take a piece of bone, make a small little chip, process it, look under the microscope, and you start seeing these. There is a central canal here. There is a canal in the center, and the cells later floating in the matrix. These cells are specially arranged. The bone is a specialized connective tissue. The cells are specially arranged. They go in a cycle around the central canal. Look at that. These are going circular infection, cycle after cycle after cycle, like an onion ring. On top of that, these little fibers, they are radiating from center to periphery. And at some point, look at that, there is a boundary here. There is a boundary here. It has its own limit. And there might be another osteon here. But this structure itself is on its own. And this structure is called osteon, O-S-T-E-O-N, osteon. Osteon is a very specialized unit for the bone. So one osteon here, the other osteon will be here, another osteon will be here. So if we put all these little osteon tube structures together, that's what we get bone. So at the end of the day, this is what I see, you know, you basically you put everything like flour, egg, butter, might be sugar, and you put in different ratio, and you bake at different temperature, at different time length, and you got the different results. And on top of that, if you want a little bit chocolate, you put chocolate. You put raisin or anything. You put that. That's, you know, that's all about our human tissue. Basically, all four, like epithelial, connective, muscle, and nervous tissue. We are going to use whatever we want for the result we want to function. So basically, a human body is nothing more than that. And this is connective tissue. It is not a new for you now. Connective tissue is made of cell and matrix. Matrix are made of fibers and ground substance. Fiber could be collagen, elastin, or reticular. Ground substance is proteoglycan, glycosaminoglycan, proteoglycan, glycosaminoglycan, which attracts water. Therefore, the cartilage is filled with water. Because of the water, it gives flexibility and bounciness and cushiness. And the cells are, connective tissue cells are fibroblasts, chondroblasts, and osteoblast. If you want bone, you use osteoblast. If you want cartilage, you use chondroblast. If you want fibrous tissue, you put fibroblasts. On top of that, there will be a few little fat cell, white cell, macrophage, and mast cell. What is a collagen? Combination of 3 amino acid chains. So elastin, the same amino acid chain. So now I hope this page is not, you are pretty familiar with this. So yeah, so we are nearly about 1 hour now. So what I would do, I will talk a little bit more about another 2-3 minutes, and I will give you a break. So just pull yourself together, sit tight, just one more slide, and I will let you go. Yeah. So now we're talking about bone, a lot of bones. So what is the function of bone? What does it do for you, this bone? Can you remove all your bones from your body? Well, yeah, the bone is important for you. It supports you. It gives you your structure, like tall person structure, short person structure, thick, strong bone person structure. So it gives you, and the muscles attached. So it supports you. And it is important for the movement. If you do not have bones, you will be like a jellyfish, like you are moving like that. Yeah. And it protects. So the skull bone, your skull bone, which is what we call cranium, it keeps your brain inside and safe. Your thoracic cavity, like your ribs and the spine, it gives you protection of your heart and lungs. And on top of that, the bone has calcium, phosphate, that sort of stuff. So it is storage. So if your body needs calcium, you can take the calcium out of the bone. If you have too many calcium in the bloodstream, you can put that calcium into the bone as well. And bone is the source for bone-forming cells, like or the blood cells, like hemopoietic cells, RBC, WBC, that come from the bone marrow, that is from the bone. And bone is also from, play a role in the energy metabolism. For something like osteoblasts, they play with the pancreas, and they ask the pancreas to secrete more insulin. So that's why the bone and the pancreas, there is some relationship. So therefore, the bone is involved in the energy metabolism. Right, guys? So it is about 11 o'clock. I will give you about 50 minutes break. We meet. Now we are talking different things now. Spine of the scapula, and this is the supraspinous process. And supra means above, supraspinous, above the spine. Fossa means space. Supraspinous fossa and infraspinous fossa. Hey, don't forget here, you can see the upper portion of the scapula become notch like that. This is what we call supraspinous notch. And this is the clavicle, this is the acromion, this is the acromioclavicular joint. Right, that's just a little starter or twist. And don't worry about that, forget about it. Let's go back to where we are. Yeah, bone, specialized connective tissue, which is made of cell and matrix. The bone cells are bone, osteoblast, osteoclast, or matrix is the collagen fiber. So how do we classify bones? A bone can be classified according to the shape. So we got long bones, and long bones, the bones are long. We got flat bones, bones are flat, irregular, the shape is not regular at all. So depending on the shape, we can classify bones, long bone, short bone, flat bone. Depending on their microstructure, they could be classified into cortical bone or canceller bone. And depending on their maturity, whether they are mature or not, mature bone or immature bone. So for, let's say, we have a broken bone and we try to set it back. The bone is healing, but not having a proper bone yet. That is the immature bone. So the healing bone is immature bone. It is still in progress. You are still in the plaster cast. And therefore the bone is not mature enough. It is the immature bone. And mature bone is the bones now we have on our body. Yeah, all these bones are mature bones. So look at that, your arm bone, or this radius and ulna or humerus, and this is your femur, thigh bone, your tibia or fibula. Tibia is the medial side, bigger one. Fibula is the lateral side, smaller one. Tibia, fibula. Look at these bones. These bones are long and long bone. It's simple as that. And flat bone, the bone in your sternum, your chest bone, or your skull bone, the cranium, it is flat. And short bone is something like the bones in our carpal bone, like in our wrist, or the bones in our ankle. The bones are really short, like a square, or irregular bone, like our spine. You know, we got this block, these spinous processes. So it is very irregular shape, and therefore we will say irregular bone. So now that is the one way to classify bone. So another way to classify is depending on their microscopic appearance, microstructure. They could be spongy or compact. In other words, compact, cortical, the same, cortical bone, spongy bone, trabecular bone. Spongy bones are softer, trabecular bones are more dense, and the spongy bones contain osteon. So look at that. This is the specimen taken from the skull. The skull bone has been cut in a section, and we are looking at the bone. And this is one layer which looks a little bit dense and thick. This is another layer which is dense and thick, and it is sandwiched like a two slices of bread, sandwiching the inner content, which is like a little mushy. So this is the spongy bone, this is the spongy bone, and this is the compact bone. So the compact bone in the skull sandwich the spongy bone. Yeah. And if you look at the trabeculae of the spongy bone, the trabeculae, the collagen fibers are running like that. And in the osteon, in the compact bone, the collagen fibers are running slightly different. That is what we need to study today. So a bone is made of cell and matrix. Cell could be osteoblast. Osteo means bone, blast means forming. Osteoclast, osteo means bone, clast means just like bone destruction, bone forming cell, bone destruction cell. Osteocytes, bone forming cells, and organic stem cells. So the cell, the bone cells, there could be four different types of cell in the bone. And matrix is, we said, collagen because it's connective tissue. But if with the bone, it's a little bit more specialized, and therefore the matrix could be divided into organic matrix and inorganic matrix. Organic matrix, which are collagen, ground substances. Inorganic matrix are like your chemistry, like chemicals, calcium, magnesium, phosphate. So what usually happens is the inorganic matrix, like collagen fibers are meshing, running. In between the mesh, in the cap, you seal with the ground substances, gelatin, like, you know, jelly-like structure. And on top of that, you force and press with the calcium, magnesium, phosphate, HA, hydroxyapatite. So you put these structure in between the collagen fiber so that the bone can really strong, so that the bone can really take your weight. Your weight might be 50 kg, 100 kg, or 100 pounds, or 200 pounds, whatever it is, your bone is going to take it. For that force to stand, we put collagen, fibers, ground substances filled with. On top of that, we put calcium, magnesium, and compress it, make it really, really strong. And these cells, osteoblasts, will form collagen. Osteoclasts will destroy collagen. That's the way we shape our bones with time. Every minute, every second, our bones are changing. Osteoblasts will put more bone on top. Osteoclasts will destroy the bones so that the bone shape change on and on and on. What is the osteocyte? Osteocyte is just when the osteoblast retired for a while. When the osteoblast is on holiday, it is called osteocytes. It is just taking a break, just resting osteoblast is called osteocyte. And of course, osteoblasts come from the osteogenic stem cells. So stem cells, that's the very beginning of the tissue. So now we know that bone is a specialized connective tissue, which is made of cell and matrix. The cells are osteogenic stem cells, osteoblasts, osteocytes, osteoclasts, and matrix, because it is specialized. It's not just collagen. It is not just ground substance. We put inorganic materials like hydroxyapatite, calcium, magnesium, phosphate. We just pound it into this matrix so that the matrix is strong enough to stand your weight. So the bone cell, osteogenic stem cell, they are mesenchymal origin. Mesenchymal origin, mesenchyme, they came from, that's the very beginning, they came from the mesoderm. Mesoderm is like when we were just got fertilized, and fertilized ovum, and the baby starting to little fetus. And that is like only three, the whole body start with the 3 layer: ectoderm, mesoderm, endoderm. So mesoderm is the origin of the mesenchymal tissue. Mesenchymal tissue is origin of the bone. And the osteoblast will generate bone matrix like collagen, ground substances. And inactive osteoblast is called osteocytes. And osteoclasts, they do not, these 3 cells came from the same origin, mesenchymal cell. But osteoclasts come from the hemopoietic origin. They secrete acid, hydrochloric acid, lysozyme, so that the bone got lysis. So the bone formation and bone destruction need to be balanced. Only then we have a stable, strong, healthy bone. If we keep forming new bone all the time, our bone will be really, 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 really hot, thick, and then finally doesn't fit the function. And the bone, if we start like removing all the bone cells, like with the osteoclast, the bone will gradually damage, and we lost the integrity. So the bone formation, which is done by the osteoblast, and the bone destruction, which is done by the osteoclast, need to be balanced to get the optimal. What is optimal? Optimal is who you are, you and me, if we do not have any bone pathology. How do we destroy the bone? With the hydrochloric acid and lysozyme by the osteoclast, and we put more collagen, more ground substance into the bone by the osteoblast. Okay, bone matrix, organic and inorganic. Organic matrix are collagen and ground substance. Collagen is secreted by the osteoblast. Ground substance like proteoglycan, glycoside, aminoglycan. Inorganic, hydroxyapatite, calcium, magnesium, and phosphate. So now I believe you have some rough idea, because I'm pushing too many information in your brain this morning, and you might be a little bit fed up and looking at me. But cell and matrix, bone matrix is this. What is mineralization? Mineralization is a process by which organic matrix is filled with inorganic compounds. So we have an organic matrix, which is collagen and ground substance, when we are putting calcium and magnesium into that matrix, that process is called mineralization. So mineralization, I want you to pick up this term, pull yourself together, pick up this term, mineralization. Mineralization is a process. It is a process where the organic matrix, ground substance, collagen are filled with the calcium, magnesium hydroxide. But that is the process. That process is called mineralization. So this is a typical adult long bone. Different parts of the bone. The shaft of the bone is called diaphysis. The end of the bone is called epiphysis. And this is the upper end, proximal epiphysis, lower distal epiphysis, and the joint surface are covered with the articular cartilage. So this is a very typical of a long bone. So if we cut it open, and this is the cross section we can see, where there is a canal inside, and the canal is filled with, usually with, for adults, you and me, the marrow. The marrow is a little bit not very good, like a red marrow in babies. So the marrow is filled with like fat, blood cells, and yellow marrow. And you can see the big blood vessel penetrating into the bone, going into the bone. That is what we call nutrient. That artery gives nutrition to the bone. That is what we call nutrient artery. So it's come like slightly close to the center of the diaphysis, nutrient artery. And you can see now the bone is covered with another sheet of connective tissue, which is what we call periosteum. Around osteum, bone. Periosteum around the bone. Yeah. So periosteum is like a blanket which is covering the bone, and the bone is a hollow structure. The bone is a hollow structure. The hollow is filled with the bone marrow, which is fat bone-forming cells. And you can see the bone. This is the cortical bone. Look at that. The bone is covered with the periosteum, and this is the compact bone. And inside, this is called inside of the bone, compact bone is also covered with another layer, which is called endosteum. So periosteum, endosteum, endomy inside covering, outer covering, and the compact bone in the center. That is the bone. This very complex structure. Now you can see a bit more detail. Diaphysis, you cut it open, and this is what you're seeing. Compact bone, yellow marrow, periosteum, and the nutrient artery going deep into the vein, into the bone. And the end of the bone, epiphysis, is covered with the articular cartilage. So the bone's outer surface is covered with another type of connective tissue, which is called periosteum. But if we are serious enough, if we can even split the periosteum, look under the microscope, and we can see difference. Periosteum has two layers: outer periosteal layer and inner periosteal layer. Outer periosteal layer is to push against, resist the force, tensional force. Then inner periosteal layer is for the bone formation, like osteoblast, osteoclast. Yeah, so even the very thin covering, where periosteum is not really thin in real life, when you do the operation, you lift up the periosteum. It is really thick, strong structure. Outer structure is for resistance. Inner structure is for nutrition for the bone by making osteoblast and osteoclast. It is firmly, really, really stuck to the bone. You really have to lift it up, the periosteum, when you are doing surgery. This periosteum is stuck to the underlying bone with another type of collagen fiber, which are called Sharpie's fiber. And periosteum is also rich with the blood. That's why, you know, the bone is not dry. The bone is really, really rich with blood. That's why when we break the bone bleeds loads and loads. If we break our femur, the bleeding might be about 1,500 ml of blood we can lose. So it is really rich with bone, with blood. And we keep talking about the outer covering of the bone, which is the periosteum, which has 2 layers. The inner side of the bone is also covered with another layer, which is called endosteum. Endosteum is just like, you know, little flimsy thing one. And it also contains the osteoblast, osteoclast. And in between the endosteum and periosteum, that is the compact bone. Yeah, compact bone. And now we are going to see something more detailed, like we are increasing our microscope power, lens power. And now it became really, really detailed. And now we can, in the compact bone area, we can start seeing one little hollow and the circular structure. That is what we saw as a histology slide in the very beginning. That is what we call osteocyte. Osteon. So the whole structure is called osteon, which has got central canal, as you can see here in the canal in the center, central canal, or you can also say Havesian canal. Inside the Havesian canal, there will be blood vessels and nerves. So the whole system is called osteon. So the red color, osteon, or Havesian system. So one osteon, another osteon, another osteon, another osteon. All these are run longitudinally along the compact bone. They are running like that. That is the bone. It is very specially arranged. It runs layer after layer after layer. So let's say this is one layer, this is another layer, another layer, another layer. It is so particular. And these Havesian system or osteon, they are running longitudinally along the long bone. Let's dig a little bit more. This is the quarter portion of the osteon. This is the central canal. You can see the blood vessel, artery and vein, and you can see the nerve here. And you can see the layers and layers and layers and layers of sheath. These sheath are called lamella. So in singular, it is lamella, in multiple lamellae. So one layer of lamella, another layer of lamella, another layer of lamella, and another layer of lamella. These are running like that. In between these lamella layers, you can see the lacuna, little pockets inside which osteocytes are resting. So osteocytes can become osteoblasts, osteoblasts can become osteocytes. So osteoblasts and osteocytes, they are sitting in the lacuna, which is in between the sheath of the lamella. What is lamella made of? Lamella is made of bone matrix, collagen fibers, ground substances, and calcium, magnesium, phosphate, and hydroxyapatite. So this sheath, the sheath of tissue here, you can see is called lamella in singular, in plural lamellae. They are made of collagen fibers, and in organic and inorganic compound like ground substances, and inorganic compound like calcium, magnesium, hydroxyapatite. So this is like layer by layer. In between the layers, we have osteocyte or osteoblast, depending on the activity. And if we go into more, there is a central canal where we contain the nerve and the blood vessels. That is what we have here. That is what we have here. And these structures, Havesian system or osteon, they run parallel along the long bone direction. And that is really, really strange. You know, the bone has been properly arranged in this detail. Let's say if you strip lamella by layer and layer. The collagen fibers are running in one direction for one layer, another direction for one layer, another direction for one layer, another direction. It is like a crisscross, 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 one after another. That is the way the bone can withstand the torsional force, twisting force, or bending force. And in the center, of course, we have the Havesian canal. Inside the canal, we have blood vessels and nerve. And then Havesian canal, another one lamella, another lamella, another lamella. And finally, if we look under the microscope, of course, we get this picture. The central canal might be vein, might be artery, might be nerve. And these are the osteocytes. And these are the layers and layers of lamella. So bone nutrition, we got bone nutrition for the bone, we got from the nutrient artery mainly, but in the epiphyseal region, we have epiphyseal blood vessel. Yes, so this, if you have time, I want you to have a look at this page in our textbook. And now, if the bone is under constant stress, so this is our skeleton, this is the right side, this is the left side, this is the femur. You can see the femur is like that. So if you remember our mathematics, one here, geometry. So going like that, the force is from here to here. So this is the compression force. On this side, it is the tensional force and compression force. One side, there is tension. The other side, there is compression. So our bones are always under constant stress and strain, and they're always under pressure. When you're walking, your body, your weight is pressing on the bone. And as I say, this inner side of the thigh is always under tension because of the shape is like that. And the outer side is over the tension, and this side is a compression. And the gravity of the weight is falling in the center. It is our spine bones are under always constant pressure. Of course, this is under constant pressure. Oh, I'm sorry. Eddie is giving me a hard time. So this, as we say, if we look in this inner side of the thigh bone, it is on the compression, and outer side, it is under tension. And the bones here, so the collagen fibers in this region of the bone, they have to arrange in different multi-direction to resist these forces. So these are not by chance, they are actively arranged to get this arrangement so that the bone can withstand the different forces we create on our bones, like compression force. Compression means pressing from the top, torsional force, twisting force, tensional force, being pulled apart. So this different forces the bone has to accept. So the bone formation, there are two types of bone formation. First thing is intramembranous, and second is endochondral bone formation. That is easy, guys. Intramembranous and endochondral. Intramembranous means the bone form directly from the mesenchyme. Hey, there is a little piece of bone, and finally became big piece of bone. That's it. So it is easy, but the name is inside, membrane, mean membrane is a sheet. So membranous, so you make a small little sheet of bone and it became big sheet of bone. Like the skull bone, our skull bone, is the intramembranous bone formation we got it from. So endochondral bone formation is you make a little cartilage model first, like our little fetus in the mother's womb, like many different parts of the body is in cartilage. The endochondral cartilage bone formation, means the cartilage is built first, and then later the bone tissue will come into the cartilage, and then the cartilage will be kicked out, and the bone replace the cartilage. So nearly every part of our body is made with bone formation, comes from endochondral bone formation, except the skull bone and the clavicle, our collarbone. So our collarbone comes from intramembranous bone formation, intramembranous ossification. Our skull bone comes from intramembranous ossification. But the rest of our body, you forget about everything. And the whole body bone formation is formed by the cartilage, because you saw the little ultrasound photo of the baby, little fetus, which is made of lots of cartilage. We know that. So this is the endochondral bone formation. You have a little small piece of cartilage as a fetus, and you gradually grow up, and little bone formation center turn up, and then the blood vessel will come into that area, feed that become big and big, and then finally the whole cartilage will be replaced with the new bone. So the cartilage, the bone which comes from the cartilage model, it is called endochondral ossification. So let's look at this picture. This is the right shoulder, which you have seen with the skeletal model. And this, of course, you know that this is the clavicle, this is the acromion, and this is the acromioclavicular joint, the joint between the acromion and the clavicle, acromioclavicular joint. And this is the humerus. Upper end of the humerus is called proximal humerus, which is broken into many different pieces. Yeah. And now this is the X-ray. This is the X-ray of a child. So the way we interpret is X-ray of the immature skeleton. This skeleton is not mature enough. Why is that? Because you can see the growth plate here, So this is what we call diaphysis. And this is the flare region of the bone is called metaphysis. And the end region of the bone is called epiphysis. And there is a clear space in between the epiphysis and the metaphysis. That clear space is where the growth plate for the bone. So this bone is still growing. So for babies, young children, which are not mature enough, the skeleton is not mature enough. And if we do X-ray for these people, we have an X-ray like that. So we will see the growth plate. Some ER doctors, they will say, hey, this is a little fracture. No, it is not. It is the clear space, which is not the bone yet, because it is just the cartilage. This is the growth plate. Growth plate, in other words, we will say physis or growth plates. So let's look at another picture.
Question.
Yep.
Is the epiphyseal line the end of the growth plate, like when it's done growing?
This one, the physis?
On the original picture, the epiphyseal line.
Epiphyseal line, you mean here?
Okay, yeah. So it is the epiphyseal plate.
So
Yeah,
when it's epiphyseal plate. So this plate is what we are seeing here. Because it is cartilage, so it is still like, it doesn't show on the X-ray, because X-ray being stopped by the calcium, isn't it? That's why cartilage doesn't have calcium, so that it is loosened area. This is what we see here. But once the bone became mature, we lost our growth plate, we lost our growth potential, and we lost this clear space. And this is the epiphysis. So let's look at another picture. Again, this is the X-ray for the knee, right knee, lower end of the femur, upper end of the tibia, and the little fibula you can see. You have been seeing this X-ray again and again, again and again. Now you become the master. You can see the joint space, the space between the lower end of the femur and upper end of the tibia. Hey, it is very wide, very, very wide. Why is that? Because little baby, they haven't used their knee yet, not like you and me. So they have very big and thick cartilage. Therefore, the cartilage which we cannot see, like hyaline cartilage and fibrocartilage meniscus, these are giving us a big space in between two bone ends. And we can see this is a little baby because the growth plate are still open. The growth plate, which is what we call physis, or in other words, it is called epiphyseal plate, not epiphysis, not epiphysis, epiphyseal plate. This is the epiphysis, this is the metaphysis, this is the epiphyseal plate, or to make it short, just physis. So this physis is still open, and therefore this X-ray is taken from the immature skeleton. I don't know the age, it might be 3, 5, 10, but the bone is still not mature enough. It is still growing. It is the X-ray taken from the immature skeleton. We can see the physis or epiphyseal plate, and this is the epiphysis. If we look under the microscope, if we look at this epiphysis under the microscope, these are the layers we are going to see. I'm not going to bore you with this, but try to remember a hypertrophic zone means the cells here are very much hypertrophic. But again, look at that. That's again strike here. This is the connective tissue, isn't it? Connective tissue, you can see the cells here and here, lots of cells in the matrix. But anyway, hypertrophic zone, proliferative zone, and resting zone. And this is closer to the joint surface. When you get closer to the bone, it becomes ossified and ossification zone. So finally, it came back to this picture. A bone, broken bone. The bone we have been studying about, this is a long bone. This is the compact bone. This is not a cancellous bone. According to their shape, according to their microscopic compact bone. And when a bone is broken, that is the way we heal. So when there is a fracture means break in the bone cortex, the blood vessels will get damaged. There will be bleeding around the fracture site. And if our periosteum, the outer layer of the bone covering the bone, is intact, the blood will be contained in the periosteum, and that bleeding will become blood clot, which in the medical term we would say hematoma, blood clot. Hema means blood, toma, oma means tumor, blood tumor means blood clot, big blood clot surrounding the fracture site. And this hematoma, because of the bleeding, there will be inflammatory cells like neutrophil, macrophage, will come into that area and will give you the inflammation in this area, local inflammation. And with time, the blood vessels will bring all the fibroblasts, chondroblasts, collagen fibers, beta, and then finally become fibrocartilaginous callus, the new fibrous and cartilage tissue formation around that fracture site. That formation is called fibrocartilaginous callus. Callus is a new bone formation. With time, you know that membranous or endochondral calcification, of course, this is endochondral calcification, and the new bone osteoblast will kick into that area, and that osteoclast will, oh, just 1 minute, please. Hello? Yep. Sorry to interrupt because it's my dad is in hospital. So he is requiring a few procedures, that's why. So yes, the first stage is hematoma formation and inflammation. Inflammation and hematoma formation will be followed by the fibrous tissue, cartilage tissue invasion, fibrocartilage callus formation. And this fibrous tissue, cartilage tissue, will be gradually replaced by the bone. Osteoblasts will kick in. That is what we call bony callus formation. And finally, the bone will heal. The bone will unite, but it doesn't get its normal strength for a few years, like 1.5, 2. Some people say for many, many years. The strength is not the same. But when the bone heals with bone. There is no scar tissue formation. Yeah. So this is the different stages of bone healing. I want you to remember hematoma formation. Easy. Break a bone, it will bleed, hematoma formation, and the inflammatory cells from the blood will come into that area. Hematoma formation and inflammation. This blood will bring the fibrous tissue, cartilage tissue, and there will be fibrocartilage formation. And then that fibrocartilage will be replaced with the bone tissue, that is bony callus formation. And finally, the bone will heal and gradually remodel. So this is not difficult. I know, it is nearly the end of the lecture. You are filled with lots of information already. So now I'm going to go a little bit easy ones. So look at that. This is the bone pathology. This is the X-ray of the pelvis or hips. This is the pelvic bone. This is the femur. This is the head of the femur. That is the neck of the femur. This is the big bony band, which we call bigger, greater trochanter, smaller, lesser trochanter, and this is the shaft of the femur. So on the left side, it looks okay. On the right side, it is broken. So this is the right fracture, neck of femur, neck of the femur. So the fracture is here, somewhere around here, and because of the fracture, the bone has been displaced. That is what we see. Why do we get it? It is really common. There are many risk factors like old age, especially female, especially smoker. Those are not active with sports when they're young. But whatever it is, when we get old, to good extent or to some extent, we are going to get this. The bone has been gradually brittle. That is what we call osteoporosis. The bone is weak. The bone is weak means reduction in bone mass. So the bone mass is gradually reduced, which means, what is mean by bone mass? The bone mass is made of bone matrix. So organic matrix, inorganic matrix gradually thin out. So the collagen fibers are not as strong, smaller, not as big. The calcium, magnesium, phosphate, hydroxyapatite are not as much as we had. And the bone became gradually soft. That is a condition we call osteoporosis. I believe we all have heard about this osteoporosis. If we have our grandma, I believe some of us must have our grandmas who have a broken bone, a femur, fractured neck of femur, osteoporosis. But osteomalacia and osteorickets are slightly different. That is the defective mineralization, which means, what is mineralization? Mineralization is the deposition of calcium, magnesium into the bone organic matrix. So the bone organic matrix is good, but the mineralization is poor. So lack of calcium deposition, lack of magnesium deposition. So the bone is weak anyway, but with time, the bone, instead of getting break, it's just because we still have good collagen fibers. So it's become gradually become bone like that. It just broken like brittle. It gradually cannot take the weight and then the bone gets bent. So these are the two conditions we have heard about, like osteoporosis and osteomalacia. Osteomalacia is the same condition in adults. Osteomalacia in children is we call rickets. whatever it is the defective mineralization. Mineralization is the process through which inorganic materials are deposited into the organic bone matrix. Osteoporosis, hey, if someone has osteoporosis and bone fracture, you have to fix it, replace the hip. And cartilage is a specialized connective tissue. You know that already. At the end of the day, it is cell and matrix. You put whatever you want and you're going to get what you want, and you have to use it appropriately in different regions of the bone for different function. And the bone growth, as we say, endochondral ossification and directly from the mesenchyme, where is it? Intramembranous and endochondral bone formation. The same thing for the cartilage. For the cartilage, it's appositional and interstitial. Apposition means you are putting from outside. Interstitial means inter means inside, statia septum, from the within. So cartilage growth and bone growth, intramembranous, endochondral, appositional and interstitial. So no big difference. But now this is the collagen fibers here. These are the pores which are usually filled with the ground substances and the calcium and magnesium inorganic compounds. So I believe you are going to see some similar pictures again and again. And now we get to the end of this morning lecture, which is bone and skeletal tissue, which is pretty detailed, but I hope it is not too much for you. I hope you can absorb to a good extent. Any question? It's not, this lecture is not on the canvas yet. I will put it.
Do you think it could be posted by today? Because I need to review some things.
Yeah, and I emailed that as well.
Okay, thank you.
Yeah, I emailed that last night, I think. I emailed that to you guys. So what I do is I try to email everything to the students, but it will come to the canvas as well. Yeah. Anything
Yeah,
else?
I have the slides, but the video sometimes I miss what you say because I get
Yeah, I
interrupted.
know, because